Hiya, I'm Amy. I'm the trial coordinator for maternity research, and I also cover family health. Here in Nottingham, we're a major research centre, so we're looking at improving health outcomes for families, children and mothers. The Generation study is a study where a birthing person can consent antenatally for a blood sample to test for 200 genetic conditions. Usually this is done from a cord blood sample, and it's used to try and get children onto a treatment pathway, possibly before they start having symptoms, based on the diagnosis of confirmatory tests. It's aiming to identify 200 rare genetic conditions, so some of the conditions that are screened for don't necessarily have symptoms until the baby starts to become into childhood, so it's just trying to get the early detection to get them onto that treatment pathway much sooner, because some of the conditions are quite hard to diagnose. So with that, there could be years of testing until a child is diagnosed with a particular condition, so it's just trying to streamline it and make it much more accessible, really. It's important because a lot of them can be quite difficult to diagnose, especially get early diagnosis. We've had children as examples that have had testing for a number of years before they've finally had an outcome in regards to the testing. And obviously if that takes 4 or 5 years, the idea of Generation is that we're cutting out that time frame from when they would have condition suspected to condition confirmed to then be entered onto the pathway. It would raise awareness because, again, not all children would be diagnosed with these conditions in early life, but also it's just getting the treatment much quicker because it would be needed. Earlier diagnosis matters because some of these treatments are time sensitive, so the sooner the child receives it, the better the outcome. It's been really positive. We've actually got a lot of parents that are contacting us because they're interested in taking part in the study. There's been a lot of media awareness into heel prick samples and cord sample blood, so it's been really positive overall. Recruitment's going really well at NUH. We're recruiting at both City and Queen's, and altogether we've currently got over 250 mums that have consented to the study, and hopefully that will continue improving. So to begin with, we've got the research midwives. We're quite a small team, so the research team have trained the midwives at both City and Queen's to try and raise awareness, because one of the aspects of this trial requires a cord blood sample. So the delivery teams are taking those on our behalf. So the research team have completed all the training, raised awareness, but then actually the delivery teams, they're taking the sample, but also little things like putting the sample in the fridge ready for us to collect. So it's actually been a huge team effort. Although we get to deal with the sample directly, we wouldn't be able to do that if we didn't have the input from the clinical midwives. Yep, so BaBi stands for Born and Bred In. It's a national trial, and here in Nottingham we have recruited over 2,000 patients. So it's where mums are consenting to have routine health data that's stored within our data cloud that would be accessible to run research. So for example, in Leeds, they have used the research because they identified that there was an increased A&E attendance for patients with respiratory and cardiovascular health outcomes. When they've done some research, it was due to air quality, so they've changed the transport links around Leeds because of air pollution. So they found a correlation between the busier roads with increased incidences to A&E. So because of that, they changed the local transport routes. So it's all about improving health outcomes within Nottingham itself and how we would directly benefit. Yeah, because it's got so much potential, because we are currently doing data linkage. So you link with dentists, the council, you can link with local schools and education. The idea is you're trying to get a broad picture of where Nottingham is and what stages these children are at, to then see, well, how can we improve? Is it, for example, there's a health inequality? Do you have children in a particular area that have a high incidence of, for example, you could say diabetes? Is that because of lifestyle effects, or is it due to inequalities in regards to quality of life? So there's a lot of potential for BaBi. You've just got to explore how you can use the data. I think the best way would be to contact the team. That would probably be best to come via email. So it's nuhnt.maternityresearch2@nhs.net.